Hello, everybody. Today we are going to talk about headaches and focus mostly on migraines. So we are going to look at different versions of headaches and how migraine develops and what are the treatments available and prophylaxis. Prophylaxis is probably even more important. So the headaches, if person has headaches and comes, for example, to emergency room, you want to ask several questions. Is there a history of headaches, and is your headache now looks very similar to old headaches? And if it does, then it's most likely tension headache, migraine, trigger point headaches, analgesic use headaches, or cluster headaches. And if it's not, then you have to look into more acute situation. Is it suspected infection like encephalitis, meningitis? Is there any kind of trauma, subarachnoid hemorrhage on the right, you can see. And depending what you're thinking, you may want to do a CAT scan or lumbar puncture, eye exam, or some other things. And if you worry about, for example, meningitis, the lumbar puncture becomes very good option. And meningitis will be associated usually with high fever and headaches, pain in eye movement, and so on. There could be other processes happening related to eyes, like glaucoma. There could be trigeminal neuralgia. There could be infection related to, for example, shingles in the eye area, and many other versions of headaches. The most common versions of chronic headaches or recurrent headaches will be migraines, and that usually is one side of the head, and they are frequently recurrent. They last for more than 4 hours, and they could be recurrent regularly or once in a while. There are tension headaches that you can see feels like a tension around head, and it's frequently relates to stress and caused by muscle in the neck and the face to pull and cause the headaches, sensation of headaches. There are cluster headaches that relate to eye throbbing pain on one side, and lasts up to 4 hours, and often will accompany with red eyes, tears, runny nose. And interestingly enough, oxygen therapy is helpful, as well as triptans, which is sumatriptan, is one version of medication that is very helpful for migraines too. Here they did mention that more serious headaches are meningitis, that's more acute. Brain tumors, that's actually majority of brain tumor will not be presented with headaches, but more likely with seizures. If there was a headache related to brain tumors, it will be most likely morning headaches and vomiting that would be gradually getting worse. And subarachnoid hemorrhage would be related to frequently head trauma of different etiology. And occasionally it will be aneurysm ruptured that will cause bleeding in the brain. And obviously that will be much more traumatic too, and urgent investigation and treatment is required to save people's life. And here on top, you can see the hangover headaches that alcohol cause blood vessel change and creation of serotonin and different other vasoactive triggers that will cause the headache. And this, I like, it appears to be Australia puts those posters about different conditions, and they're all inclusive. It shows you that migraine is third most prevalent disorder worldwide. Migraines are top of 10 disabling medical conditions in the world. approximately 1 in 10 Australians suffer from migraines. And similar statistic is correct for United States. Women are twice as likely as men to have migraines, even though in the United States, it's actually 3 times more than men. And 90% of migraineurs have family history of that. There are different causes for migraines, and there are different triggers. You can see as one of causes here, it's neurotransmitter imbalance, especially serotonin, brainstem activation, in trigeminal nerve, MTHFR polymorphism, and we talk about MTHFR gene mutation frequently in terms of other conditions, but it shows up in so many medical chronic conditions that it seems like it's worth checking everybody for this gene. Then cortical spreading depression, neurovascular dysfunction, those are all causes. The triggers are what actually can trigger people, and it could be light, it could be smell. Hormonal changes always is a big one, especially for women. Different foods that will contain tyramine, like red wine, aged cheese, smoked fish, chicken liver, high nitrates, like bacon, hot dogs, and salami. Some people will get it from chocolate, nuts, peanut butter, avocado. Those are more high histamine foods, actually. Dairy products in some people, and fermented pickled foods. Those are all high histamine foods. Food additives like MSG, artificial sweeteners can be a trigger for some people. Skipping meals, because it appears to be, if you start getting hypoglycemic, that can trigger headache. Alcohol per se and caffeine, those are all common triggers. It shows here the migraine pathways and how MTHFR gene mutation is involved. There are different versions of pathways that are described, and I will show you another one which shows how possibly it happens. And you can see that on the lower right in figure 2, neurovascular pathways play important role, where there is a change in vasodilation when it happens. The size of the blood vessel changes, change in nerve cell activity, chemicals in brain change and cause blood vessel dilation and inflammation in surrounding tissue. So all of those are part of the headache and migraine production, in a sense. And risk factors, non-modifiable will be your genetics, gender, and age. And in the other ones could be modifiable. And you can see that here the statistics from United States, as said, women are more 3 times more likely to have migraines compared to men. Frequently, migraines start early in adolescence or late childhood, and it peaks in individuals in their 50s, and then it starts going down and rarely occurs in 80 or older year-olds. And if you have ineffective treatment of acute situation, that obviously becomes a risk factor for chronic migraine. Or if you overuse your acute migraine treatment, that can lead to chronic migraines. Weight, obesity is one of the modifiable risk factors for chronic migraines, and stressful life events. So migraines has different phases. In prodrome, you may have yawning, cravings. Then you get into aura, and some people will have aura and some people will not. The aura could be visual, when you can see different flashing of light, zigzags in front of eyes, maybe muscle weakness, tingling sensation. And some people may even have symptoms similar to stroke. They may have hemiplegic migraines when half of the body doesn't move. And it could be very scary if it happens first time. And of course, it requires the workup related to stroke, and it's very appropriate to do that first time. And then if you keep having those, then you don't need to do the workup, but it just indicates that that's version of migraine you have. Then the next step is actual migraine, and it will be associated with irritability, throbbing pain, nausea, and vertigo in many people, sensitivity to light, sound, and smell. The best thing you can do at this point is to go lay down in a dark room and try to sleep. And there is a positrodrome. After the headache is gone, you may still feel hangover and tired for several hours or even days. So migraine is not easy, and it's definitely could be disabling. This is another description of how things probably occur during migraine. There used to be vascular theory that something triggered vasospasm and then vasodilation, meaning that blood vessel constricted, then they opened up. But that theory was debunked, and now the acceptable mechanism is neurovascular hypothesis, where the migraine originates along trigeminal vascular system, with trigeminal nerve being a nerve in the head and face. And that's why the pain usually goes along the trigeminal nerve pathway. And that blood vessels indeed will get vasodilated there because of those vasoactive neuropeptide, which includes CGRP, neurokinin A, substance P, and that's a release of those chemicals causes that vasodilation and then cause the inflammation and pain. And because of that, those vasoactive neuropeptides work through receptors, and those receptors became a target for the treatment. So the migraine occurs frequently not by itself. It's associated with a lot of conditions, including psychiatric positions like anxiety, bipolar, depression, panic disorders. It's as well associated with IBS and high prevalence of celiac and gluten sensitivity. Clearly is a part of the picture. Migraine can be associated with snoring, sleep apnea, insomnia, and different neurological disorders like Tourette syndrome, plus more likely to have strokes, epilepsy, and essential tremor, cardiovascular disorders like hypertension, mitral valve prolapse, Raynaud's, and the pulmonary disorders like asthma. So that's a big involvement or association of migraine with all kinds of conditions. The acute treatment, you can see here, it's very small, but different medications are listed. If you will go in classes, it would be acetaminophen, non-steroidals, different triptans. Those appeared later on and quite popular and quite effective. There could be anti-nausea medications that are shown to be quite effective. And here, some of them, like codeine with aspirin and other pain medications, are listed too. Magnesium infusion, prochlorperazine, that's another anti-nausea type of injection, could be given tramadol with aspirin. Those could be part of acute treatment. And some people, Fioristat, Fiorinol, which will have butalbital, acetaminophen and caffeine, and different combination of that, because caffeine frequently has nice abruptive actions. Dexamethasone is a steroid that could be used intravenously. Ergotamine, which works through estrogen and could be oral agent, and few other ones that you can see here that including valproic acid, which is anti-seizure medication. So different medication could be used, but frequently people actually prefer not to take either any or prefer to take minimal amount of medications that they can tolerate, and because many of those agents, they have a lot of side effects. This is explanation about different triptans. Zolmitriptan as a nasal spray, and you can see here different amlodiptan, flavotriptan, and kind of gives you idea how to choose those triptans. And if they don't work, then obviously you may need to have a combinational therapy, and that's many people end up doing that. With triptans, they're great, but they can be associated with vascular issues and may not be beneficial in people with cardiovascular disorders, and that's why they usually supposed to be taken no more than 9 per month. And of course, if you have quite a lot of headaches, more than 6 headaches per month, then you probably want to be on prophylactic medications. And for prophylactic medications, it could be this Delproix, which is anti-seizure medication, but it could be used as prophylactic for migraines. Unfortunately, it can be associated with weight gain and some other side effects. Metoprolol, propranolol, timolol, those are beta blockers. Topiramate is originally anti-seizure medication, but is shown to be very helpful for migraines and has a nice side effect of reducing weight, and is actually part of weight loss medication called Xemia. Amitriptyline, venlafaxine is different version of antidepressants from different classes, could be utilized. Candesartan, clonidine, those are lisinopril, those are blood pressure medication from different classes. Carbamazepine, more anti-seizure agents, and so on. The botulism toxin is here listed, and that's why I started actually exploring this topic about headaches, because I learned that botulism toxin could be used as injectable for prevention, and therefore I wanted to learn more about this topic. And newer agents are 5-HT type of agents. They're serotonin non-triptan receptors. They're definitely quite newer, and they don't even vasoconstrict, so they don't affect the vasculature, and because of that, they could be safe for people with cardiovascular disease. And CGRP is calcitonin gene-related peptide that is one of the chemicals that's released in the brain and will be causing the vasodilation. And here, if you block receptors, then we hope that this vasodilation is not going to happen, and that's how it works. And there are a couple different versions of these agents. They cropped up one after another a few years ago and became quite popular options. I do feel that in my patients, some people will respond really, really nicely, and some people will not. And they probably say that about 60% of people will have some kind of relief of the pain with those type of agents. Of course, since we see that women have a lot more migraines, and women have a lot more estrogen, so there must be some kind of relationship of estrogen and migraines. And apparently it's more not the presence of estrogen, but fluctuation of estrogen is the culprit here. High estrogen by themselves can trigger migraine, and drop of estrogen clearly can do that. So therefore, if we can maintain stable estrogen, that could be very beneficial for prevention of migraines. And people may not necessarily have association of progesterone with migraines, and there is no data on micronized progesterone and or cyclical or continuous. Other thing that I've used in my patients is elimination of estrogen altogether with a special class of agents called GnRH antagonist or agonist, and you can pretty much suppress production of estrogen, and that way you preventing all kind of fluctuations of estrogen. It's of course more drastic treatment because women do need estrogen for bones and all kind of other functions. But I've had a couple people who were quite desperate and nothing else was helping, and we had to eliminate estrogen by using this type of agents. And I did now find that there is a research from 1997 when that was utilized. So there is a strong connection between migraines and guts, and guts have, you can see here, stressful, for example, going from top, stressful induced by psychological or physical factors, they lead to release of CRH, and that leads to cortisol, and higher cortisol can change your microbiota. And the microbiomes, this dysbiosis can change the production of different IL-18, IL-1 beta, T and F. Those are pro-inflammatory type of chemicals that our body produces and part of immune system regulation. And that can stimulate those pain nociceptive responses in trigeminal pathway and trigger the migraine and other inflammatory disorders. So clearly there is a link between stress, migraines, and guts, and altogether inflammation. So because of that, we would think whatever will help our guts may help the migraine. So, and we clearly know that subset of patients will be sensitive to different parts of the food, and those foods will be triggers. I found several articles about the probiotics, and one of them, for example, established that 80% of participants experienced significant improvement in quality of life and pain relief in more than half of the migraineurs in that study. And there were a few other studies with different probiotics that were helpful. And there was quoted another one study that actually did not do much. I reviewed one nice article that said that healthier diets defined in multiple ways, most likely more vegetables, and meal regularity, having regular meals, weight loss, those are all associated with decreased migraines, headaches. Specific diets like ketogenic diet, low glycemic index diet, DASH diet had modest evidence for prevention of migraines. For people who are not celiac disease, just simple gluten-free diet did not do much. but people who were sensitive and actually had celiac disease. That's where that diet made a difference and helped with migraines. There are some alternative treatment that could be utilized, including exercise. Apparently, anaerobic exercise can reduce migraines, but more studies is needed. And on the left, you can see there is a device that you put on your neck, and it's somehow electricity and vibration, all of that somehow improves and reduces the migraines. So there are some, I've seen seeds for the ear, I've seen some other similar devices that could be part of the treatment for people who cannot tolerate oral agents. Herbal supplements, the most frequent ones I've seen will be coenzyme Q10, riboflavin, which is vitamin B2 at high doses, fearfu, which is good anti-inflammatory, magnesium. And based on this article that had published studies in the last 10 years, conducted in 18 to 65-year-olds, the herbal supplements and nutraceuticals definitely helped reduce frequency of migraine headaches. And I put example of one of them, which is Migranol, and it has exactly riboflavin, fearfu, magnesium, plus it has curcumin. So that's that. I've seen one article here about, and it was 9 studies review, like meta-analysis for medical marijuana that showed a significant clinical response by reducing the length and frequency of migraines without severe adverse effects. Of course, when you read more articles about medical marijuana, there could be adverse effects. It's good that it wasn't here, but technically it may be associated with different versions of adverse effects, like nausea, itching, paranoid ideation in certain people, and so on. But if person tolerates it well, doesn't have side effects, it could be a valid treatment. Of course, it's not available in all states and not legal on federal level at this point. So this botulism injections, you can see here the muscles, and if you put injections in certain places in forehead, plus for migraines, it could be actually on side of the head and on the back of the neck. Those could be useful in the reduction of muscle tension and migraines. And I think it should be really helpful for tension headaches too, because technically it will help to relax those muscles that you can see here. And because of that relaxation, it should help with tension headaches tremendously. There was one article about acupuncture, but it was proposal of studying it, and therefore I didn't find the actual conclusion. But that's one of the possible treatments too. And that's all I put together this time. So as a conclusion, we will say that we have different options for headache treatments, and some of them are more effective than others. And technically, you probably need to just go from one to one to see what will work the best.